For severe hypertension, renal denervation is a new option that could be offered. Promising evaluations are underway, and Henry KRUM summarised during ESC 2011 the current evidence from the Simplicity-1 study, the first-in-man uncontrolled experience, and also the Simplicity-2 study, the first randomised prospective evaluation.
The two studies really had very concordant results. In the Simplicity-1 study without a control group, it was about a 30mm reduction in systolic blood pressure at 12 months. This is from patients starting in the high 170s on about 5 different antihypertensive drug classes. And that was sustained out to 24 months. And in Simplicity-2, even though there was a control group, the result was almost identical, about a 30, slightly greater 30+mm reduction in systolic blood pressure. The safety of the procedure is very good, in fact, and short and long term, the complications have been very low.
The impact of ACE and angiotensin II receptor blockers on all-cause mortality is a question that's not been clearly assessed yet. This is why Michel BERTRAND conducted a meta-analysis on 165,000 patients from 19 trials. He reported the main results during ESC 2011.
And what we observe is overall a reduction of all-cause mortality by 4%, highly significant difference, which was not very well demonstrated in the past. And more interestingly is to observe that there is a difference between ACE inhibitors, which reduce significantly by 8% the all-cause mortality, and ARB, angiotensin receptor blockers. We have no effect at all, no significant reduction on all-cause mortality. We looked at the heterogeneity in the trial, and we found that among ACE inhibitors there was an heterogeneity and in favor, for example, of a drug which name is perindopril, in comparison of enalapril, lisinopril, etc.
Blood pressure variability and its impact on prognosis is an important new concept on which Denis CLEMENT shared in Paris his take-home message for practitioners.
These recent studies show that when the blood pressure in between visits is measured, and you see that it changes all the time, that this variability that we use now to call inter-visit variability correlates with prognosis, and more especially with the danger to develop stroke. Now, this is an important entity we absolutely did not know at all. Take-home measure is, please record your blood pressure of the patients, and keep all your values. Secondly, if there is somebody with what you see having a high level of variability, reflect for yourself that the calcium antagonist could be a good way to treat that sort of patients. And 3 is, please follow the literature because this is in full evolution.